Hi, I'm Mike Thompson, and we're in my office in the United States Capitol, and tonight is the State of the Union. The President will come to the House chambers and give his State of the Union for the entire public to see. I won't be there. I've been designated as a designated survivor, so I will be off campus. But I have a guest. Every member of Congress is allowed to bring a guest. My guest is from Benicia in our district in Solano County, Andrew Blackshear, who I've known for quite a while now because of a very unfortunate situation where he had a medical emergency, and it was because of the Affordable Care Act that he was taken care of and got the health care he needed, and now the protection for people with pre-existing conditions that is covered by the Affordable Care Act ensures that he has health insurance going forward. So Andrew, thank you for coming. I appreciate you being here. I appreciate all the work that you've done to promote access to quality, affordable health care, and say hi to our constituents and our neighbors.
Hello everybody, I'm happy to be here and happy to be live as well. I was on a privatized insurance that didn't cover pre-existing conditions, and I was accused of having one, and I had to jump through some hoops to prove that, and then I got on the ACA, and they zeroed out all my bills on my second insurance plan, and my second surgery went well, and here I am today, you know, and I'm still on the ACA, and I'm happy about it.
And you're healthy.
And I'm healthy too.
And your medical experience was a tragedy, yet something that anybody could be susceptible to.
Of course, you know, like it's one of those things that you don't think will happen to you. And
tell folks what happened.
So basically, I was a very healthy individual. My family really wanted me to get health insurance. You know, I was low income, so I got on privatized insurance while waiting for the open enrollment for the Affordable Care Act, and that's when I randomly breathed in a fungus and it went into my lungs. I had a fever, and then it went through my lungs to my heart tissue, and it killed my pericardium. So over the course of 8 months to maybe a year and a couple months, that was my big fight, and it's split down the middle. I was on the privatized one first, on my first heart surgery, and they did not want to pay it, and that was over $200,000. So if they hadn't paid that, I don't know if I would have been able to move forward with my health care and the care I needed to survive. So I mean,
this was valley fever.
Valley fever.
Breathed
yes.
in some dust and fungus, and you were the recipient of a tragic and terrible disease.
Exactly, out of the blue too. You know.
So now you got your surgeries.
Mm-hmm.
It was covered by insurance. You had to pay something, but the insurance
exactly
covered most of it.
Covered
You're
everything.
healthy now.
I'm healthy.
You're working. You're contributing to your community. You're contributing to the tax base. You have your own business and your own home.
Business in my own home. Yeah.
Sounds like a success.
It's a success.
Well, thank you for coming out.
Thank you for having me.
And telling your story.
Thank you.